Welcome, everyone. Hi, thank you for joining us for today's Schwartz Center Compassion and Action webinar, which is entitled Why Social Support Matters for Frontline Caregivers Right Now. I'm Stephanie Adler-Yuan. I'm Director of Programs here at the Schwartz Center. As many of you know, we're a Boston-based nonprofit organization. We've been around since 1995, and since then we've been working hard to advance compassion in healthcare. We have always been focused on improving relationships of care to foster healing healthcare systems. And I know so many of you are committed to that work as well. We focus not just on patients and families, but for the healthcare workforce, on the healthcare workforce as well. And that's what we're going to talk about here today. So before we get started, I just want to note for everyone that today's program will last about 60 minutes. We will have a presentation for about 40 minutes or so, and then we will leave some time for questions. The questions will be, this is a webinar, so the questions will be via the chat and the Q&A function that you see at the probably bottom, possibly top of your screen. So keep an eye on that. Last but not least, I want to acknowledge, as always, that this Compassion in Action webinar series has been funded in part by a very generous donation made in memory of Julian and Eunice Cohen, and we're so grateful for that. So with that, I'll hand the event over to today's presenter. Dr. Beth Lown is a dear colleague, and she's Chief Medical Officer here at the Schwartz Center, as well as an Associate Professor of Medicine at Harvard Medical School. I know she's really excited to share this incredibly important work with all of you today, and so I'll hand it over to you, Beth.
Thank you, Stephanie, and thank you, everybody, for joining us today. I'm really excited to be talking about this topic because it is so incredibly important. We're going to talk a little bit about the current status of caregiver well-being. I'll show you the different kinds of social support and what the evidence says about their impact. We'll talk a little bit about where our Schwartz Center programs fit in, and then we'll end with a brief word about resilience and post-traumatic growth. Some of you may have seen this image of the stress continuum from our stress first aid program. This reminds us that we all really fluctuate along this continuum from green, ready to go, feeling really fine, motivated, in control, to yellow, which is where I think many of us function a lot of the time in healthcare because we're always responding to stressors, whether at home or at work. And this can actually result in some mild or transient changes in our mood or motivation, focus, and even some somatic symptoms. It's when we start getting into the orange and the red zones that we start to worry a bit, because these can occur in circumstances such as trauma, traumatic circumstances, which would include the pandemic, for example, experiences of loss, moral injury, when we're acting in ways or observing others act in ways that really violate our most deeply held values, workplace violence, and just the wear and tear of everyday life in healthcare. And this can result in more severe or persistent distress and impairment, feeling like you're not in control of yourself, you're not the same self you used to be. And we really want to leap into action if we can before someone hits this zone or stays in this zone, because this can leave scars and can potentially progress into the red zone where we're really feeling ill due to unhealed orange zone stress injuries, other stressors, or risk factors. And this can result in some really clinically significant mental health disorders that result in functional impairment, anxiety, depression, symptoms of traumatic stress, or behavioral disorders using substances to cope. So what I'd like to do is just launch a poll. So I'm going to ask our team to launch this poll. Over the past month, in a typical week, where would you have placed yourself on this poll? So jump in and participate. I really want to see where you all are at. So I see some numbers coming in. Keep at it. We'll just wait another couple of minutes. People are still responding, so I don't want to cut us off just yet. Keep going. Okay, I think we can stop the poll. It looks as though about 66% are in the yellow zone 20 in orange, 1% in the red, and 12% in the green. And I have to say, this is kind of what we have been seeing, although in some settings and contexts, I have to admit that I'm seeing other kinds of more significant orange and red attestations. Can you close the poll for us, my team? Thank you. Let's see if I can regain control. Here we go. You know, somehow we've gone from gratitude to hostility. You know, at the beginning of the pandemic, we were just uplifted. People were coming out on their balconies or in their apartments, clapping from their windows at 7 o'clock. But as the pandemic has worn on and worn us down, we have seen a real uptick in violence and hostility against healthcare workers. In one survey of nurses done late 2020, of more than 15,000 US registered nurses, 20% said that they had experienced increased on-the-job violence, which they attributed to COVID-19 related staffing shortages, changes in their patient population, restrictions for visitors, and increasingly public health mandates. So stress is high amongst our caregivers. And you must know that when we say caregivers, it means anyone who touches the care of a patient or family in a given healthcare setting, wherever it may be. So stress is high, but you know, there's some heartening news as well. This is a very small excerpt of data from the AMA's Coping with COVID survey. It was collected between May and October 2020. And the survey data encompasses more than 20,000 healthcare workers across all roles, and it includes an average stress score, anxiety, depression, burnout, and other kinds of measures. The score on the average stress scale ranges from 4 to 16. Across all roles and professions, you can see that the average score was 9.52, so not as bad as it can get, but not great either. 30% reporting high stress at the time of the survey, 61% fear of exposure, 38% are reporting anxiety, 43% work overload, and about 50% are reporting burnout. But there's also something interesting here. 50% of caregivers reported having a sense of purpose, and 46% report feeling valued. And there's something very important in that piece of information. So who exactly is at greater risk, and what is protective? Highest stress summary scores were seen amongst women, Black, Latinx individuals, inpatient workers, nursing assistants, medical assistants, and social workers. This is probably not a surprise to you. The highest burnout rates, OT, speech therapy, and social workers. Highest sense of purpose, and I think there's something interesting in here, nursing assistants, pharmacists, respiratory therapists, housekeeping, and food service. And I think that's interesting because especially in housekeeping and food services, very frequently these are staffed by populations that have been really hardest hit by the pandemic. Highest sense of being valued, rehab services, admin, finance staff, and IT support. And it looks as though stress and burnout are associated with fear of exposure or transmission to loved ones or even other patients, self-reported anxiety, depression, and work overload. And I think what's important here is that less stress was associated with the feeling of being valued by your organization. And this is an important message for leaders, for managers, for supervisors, anyone who is overseeing a group of caregivers. What would it take to help that workforce feel valued? Very important to be thinking about it. There is another poll. This is a Washington Post Kaiser Family Foundation poll of 1,327 US healthcare workers from March of 21 to from February of 2021 to March 2021. And again, here you can see that 62% of the respondents were saying that COVID worries were having a negative impact on mental health. I'm showing it here now, though, because I want you to see that the highest toll of this sense of worry, sense of concern is really falling heavily on the shoulders of our youngest caregivers, the presumptive future of our healthcare workforce. But at the same time, take a look at this. 76% are feeling hopeful, 67% optimistic, 63% motivated about going into work every single day. This is like really important because we hear so much of the negative messages. And what we don't hear is this information right here. And again, it's so important to support this sense of hope and optimism and motivation, and particularly among those who are supervising, overseeing, or leading caregivers, and especially those who fall into this younger age group. So let's keep that in mind. Now, what kinds of support do healthcare workers need in a pandemic or any other kind of crisis for that matter? There are 4 kinds of social support that I want to talk about. These are informational support, logistical, practical support, psychological, emotional support, and social support. And I'm going to share with you what I found in my review of what's out there in terms of existing literature, meta-analyses, systematic reviews, and so forth, about what kinds of interventions seem to help support workforce well-being. And I've broken this down into kind of a matrix that includes timing, before and during. I'm not going to talk about after. And also targets of the intervention, i.e. individual, team, or organizational targeting. So here's the first slide in this series. What kinds of individually targeted interventions are helpful in supporting work resilience and mental health? Well, you'll see that emergency preparedness infrastructure and skills training, along with disease-specific education and regular updates, these build confidence and a sense of competence in the workforce. And this is built into our hospital incident commands and other kinds of infrastructure that are undoubtedly in place already. But what's not in place and has not been proactively implemented is anti-stigma messaging about it's okay to reach out for help if you need it, and psychoeducation about the nature and the impact of trauma. What kinds of reactions are common? What should we anticipate? And messaging campaigns that it's okay to ask for help. This should be part of all ongoing activity for all healthcare organizations where caregivers are regularly exposed to suffering. We know that there was such a significant proportion of the workforce that was burnt out well before the pandemic hit us. At the individual level, evidence-supported interventions include just plain old common sense approaches that emphasize natural coping skills, reframing, positivity, acceptance, and also the more structured kinds of skills training that many have implemented based on cognitive behavioral therapy principles and also mindfulness-based skills training. These seem to have some evidence behind them. At the team level, there is scanty, high-quality research on team-level interventions to support resilience in crises and in pandemics. Doesn't mean they're not effective, it's just that we don't have enough information on this. There is evidence from a 2021 meta-analysis that was done by the US RAND Corporation, National Defense Research Institute. They were looking at stress control interventions for the military, law enforcement, and first responders. And what they found is that some interventions, some of which are mentioned on this slide, can improve stress, absenteeism, psychological distress, and return to duty, but had no significant impact statistically on anxiety, depression, PTSD, and substance use. There is one kind of an intervention of peer group support that's called TRIM. It was actually developed by Dr. Neil Greenberg. He was one of our speakers in our early COVID-19 webinar series. He developed this intervention in the UK for the Royal Navy and other arms of their armed services. And this involves and teaches service members in psychological first aid and how to identify and refer highly distressed individuals to early treatment amongst the service members. It is very similar to our stress first aid program. So research on this program, there are 2 studies available, showed that the program did support reducing psychological distress and stigma around help seeking. I will tell you that there is an ongoing government-funded here in this country from the Patient-Centered Outcomes Research Institute. This is funding a study of stress first aid. And there is currently a randomized controlled trial going on to study the efficacy of stress first aid. And I'm going to talk more about that in a little bit. Data from a pre-pandemic large government-funded study of Schwartz rounds in the United Kingdom showed that Schwartz rounds themselves significantly reduce psychological distress. And I'll talk more about that. And these can be offered at the team or unit level. And there are other supportive initiatives, daily well-being check-ins. I'm going to talk a little bit about the use of the stress continuum in that context. And World Health Organization has a very extensive review of evidence and data and recommendations around manager and supervisor support, including the option to decline frontline shifts, rotating workers from high to low intensity tasks, limiting shift duration, depending on task intensity, and scheduling and enforcing breaks and days off, time off for workers with personal trauma or loss. Now, it all sounds good, and I know many of us are struggling in our organizations and systems with staffing shortages. So this is recommended and may actually be difficult to implement in the current context. At the organizational level, most of the studies on impact on well-being and resilience include preparedness, enabling conditions, and practical support. And so you'll see, again, this pre-crisis preparedness, ensuring sufficient staff, materials. Again, it sounds great. I know we were just struggling, and we still are struggling to some extent to get adequate PPE and other resources. What I think is interesting here, too, pointed out, is pre-crisis planning for ethical dilemmas. And certainly that's really problematic, where now states are having to invoke crisis standards of care and making life and death decisions about who gets what kinds of care. Very traumatic for those who are involved in that kind of work. In addition, the enabling conditions for organizations, you can see here, judgment-free ability to request support and report incidents, multidisciplinary support teams, 24/7 access to help, and financial compensation and the like. I want to mention again that Schwartz Rounds is an organization-wide initiative as well. And again, I'll talk a little bit more about our data on that. And then, of course, practical support. So you can see that these are some evidence-informed interventions at 3 different levels for before and during a crisis. I want to share this really interesting case study. This was generously written up and published by Dr. Carol Bernstein and her team at Montefiore Medical Center, and it was published in the Joint Commission's Journal on Quality and Patient Safety. The Montefiore Health System has a lot of different facilities associated with it. This is a case study of what was offered at Montefiore Medical Center in the Bronx, of course, the epicenter of the first wave of COVID-19. Montefiore Medical Center is the largest employer in the Bronx, and the hospital serves a very diverse population. And also its staff is extremely diverse as well. So they recognized very early, because both staff and patients were really hard hit by the impact of the pandemic, and they really needed to mitigate the psychological distress, not just amongst patients and families, but among staff as well. And so they set up all of these incredible resources, lots of psychoeducational resources, people doing grand rounds across different specialties. Of course, that was primarily for physicians. There are a lot of web-based resources and infographics on youth-based concerns. There was an emotional support line that was staffed 7 days a week by mental health providers. Caregiver support centers, these were like respite rooms where people could go and just take a deep breath, dimly lit, comfortable chairs, soft music, and so forth. They had SMART and Smart Fam, they abbreviated this. This was rapid short-term telehealth psychotherapy consultations, medication adjustments when necessary. And they also had family group sessions, parenting group sessions as well. There were team support sessions. They offered a lot of these, and these were largely determined by unit or team leaders in terms of what the content should be and how long they should last. They offered this Montefiore Emotional Support Allies program. This is similar to something the military does called Battle Buddies, where they pair up two service members to be available to each other should they need help or support or moral support. And in this case, caregivers on the front lines were paired up with, again, mental and behavioral health providers. It was a wellness series and, of course, clergy support. So just a whole host of different kinds of supports and resources. But what did people use? And I really appreciate them for publishing this information. So not too many people were accessing the infographics. I don't think they tracked hits to the resource website. The emotional support line, very few calls. And in fact, that whole thing was discontinued as of mid-June. I think probably when the surge started to wane just a speck. The caregiver support centers were far and away the most commonly accessed supportive resource. Lots and lots of visits. They started offering them at the other hospitals within the system as well. These smart referrals and mostly self-referred for short-term psychotherapy. Some, not a lot, but of those who did take advantage, 73 remained in active treatment. Parenting groups, not so much uptake. There are a lot of support sessions offered, very variable participation in that emotional support program, and very little uptake in clergy support, probably because people were seeking out their own clergy rather than on-site clergy. So it's interesting, the authors hypothesized that people the accessing of these resources were really limited simply by sheer exhaustion and stress, and also a disinclination to acknowledge vulnerability or to seek care. It's important to remember, though, that although some of these services may not have been accessed to the full extent possible, some may have been life-saving, and I think it's important to remember that. So we're going to sort of zero in right now on the notion of social connection and social support, and for very simple but really, really important reasons. Social connection is an absolutely fundamental human need, but the strength of our connections strongly affects our well-being, our physical health, and believe it or not, our longevity. Social support offers connection with compassion for those who are suffering. So that is the connection between social connection and social support. What do we mean when we're talking about social connection? Again, there are ways of experiencing social connection, at least 3 ways. People experience it by virtue of being integrated into various social networks. And I'm not talking about Facebook or LinkedIn here. I'm talking about real personal relationships. People experience social connection by receiving actual practical support, and also by their perceptions of feeling supported. So what does the evidence tell us about the importance of social connection? This really is astounding. There's such a robust body of evidence around this. We can see that social connection certainly affects our sense of well-being. People who are more socially connected are happier, less depressed, more satisfied with life. But it affects physical health too. We see slower age-related declines in cognition, better immune responsivity, faster wound healing, slower progression of chronic illness, chronic vascular disease, and longer life expectancy. More on that in a second. And for those of us who have to prove the return on investment in such things, fostering social connection at work is good for business. We have healthier, more engaged employees, higher quality of work, fewer injuries. So that's all really interesting. And, it's like, I understand why social connection should affect our mental, well-being, but why is it affecting physical health? That's a little trickier to understand. It turns out that the brain interprets social disconnection as a threat to survival. So whether that disconnection is caused by the loss of a loved one or feeling excluded or marginalized or discriminated against, what happens is that perception, that feeling of disconnection actually sets off a physiological stress reaction that activates our sympathetic nervous system, sets off a cascade of hormonal responses that in the short run, helps us survive. But when that stress response is sustained over time, it really can impair our health in all kinds of ways. So you can see the neural regions highlighted in red that process this sense of perceived threat or harm. I think what's kind of interesting that some of the neural regions that process a sense of safety, highlighted in blue, overlap with some of those that also process perceptions of compassion. So the data about social support is very, very robust. It's very impressive. This is the results of a meta-analysis by Julia Holt-Lundstedt across 148 studies, over 308,000 participants. There was a 50% increased likelihood of survival for participants with stronger social relationships. And this finding was consistent, didn't matter the age, the sex, the initial health status, the follow-up period, or the ultimate cause of death. The association was strongest for people who had the strongest or greater degrees of integration into a variety of social relationships and communities. And what this figure shows is that the influence of social relationships on the risk of death are comparable, if not greater, than well-established risk factors for mortality, like smoking and alcohol consumption. And they exceed the influence of risk from things like physical inactivity and obesity. So you may be assuming that this applies just to our close relationships with our partners, our children, close family and friends, but that's actually not true. There's good evidence that our social connections at work are just as important as those outside of the work setting. And after all, we spend so many hours in the work setting anyway. The trouble is that many of us are just not okay with not being okay. And we're just very reluctant to seek help. Again, one more thing from the Kaiser family and Washington Post poll that I showed you a little bit earlier. 13% of folks did receive mental health services. And you can see what some of them were experiencing up at the top of this little figure here. Over half of people were feeling they were having somatic symptoms or increasing substances to cope. 13% received mental health services, but 18%, although they thought they needed mental health services, did not receive them. So what I'd like you to do right now is pop into the chat why it seems so difficult for us to reach out for help. Why are healthcare workers not okay with not being okay? So just pop this into the chat. And Stephanie, I'm going to ask you to read some off for me, if you will. Let's see what's coming in.
I would be happy to. Oh gosh, they're coming in really fast, Beth. You definitely touched a nerve here. Fear, stigma, judgment. They don't want to burden others. A lot of stigma because we need to be the heroes. Time, pride. A lot of themes coming through here. A lot of stigma, stigma, stigma. We're busy, Mary Ellen says. The fear of the perception that you won't be able to do your job, fear of job security. We've been trained to handle this, to handle anything, we could say. It's embarrassing, so shame that ties to the stigma, that we might need help, fear of judgment by others. I think people are
Oh my gosh.
all over it.
Yeah, exactly. So you can stop now. Hold on, because we're going to go on a little bit more now, right? Thank you for participating in this. And it really echoes a lot of what I've heard when I've done this in previous talks. So thank you for participating in this. Let me show you what, the Kaiser family Washington Post poll revealed. Very, somewhat similar to busy, afraid, embarrassed. Again, that stigma theme. Couldn't afford it, couldn't get time off work. That's tough. We can address that, I think. Let me ask you, Have you heard things like this? I'm fine. I can handle it. I don't need help. And on the other hand, I can't ask my team to cover for me. I don't want to let them down. I can't burden them. Everybody's overstretched as it is, right? So I have to say that there are these sort of two major themes, I think, in addition to sort of just the practical things up here. One is our stoicism. I mean, we are trained to just sort of buck up, carry on. And it's one of our qualities that make us so professional and great. On the other hand, it's a profound source of vulnerability. And then this sort of other theme about not wanting to place any additional burden on our teammates, on our coworkers, on our friends, on our colleagues. And I know I have heard these sort of dual themes and more just recurring all the time during virtual Schwartz rounds in the pandemic. Now, for those of you who are unfamiliar with Schwartz rounds, the program allows for interdisciplinary conversations about some of the most complex and emotionally challenging and compelling things that we face in our daily work every single day. Focuses on us, the caregivers, and what we're experiencing, and it offers a place to listen, to offer, and to receive support. Many of our members during the pandemic pivoted to doing virtual Schwartz rounds using our trauma-informed guidance. And again, in many rounds, I have heard these themes, some of which appeared in the Coping with COVID survey that I reviewed with you a little bit earlier: fear of exposure, anxiety, grief, and loss. But I also have heard many participants talking about their profound sense of belonging to a team, their gratitude for knowing that others are sharing this experience and are supporting them. Gratitude and appreciation has been incredible and incredibly meaningful. So I think being able to hold all of these conflicting emotions is just really important in stimulating resilience and the ability to cope. More on that. I want to share with you some of the data that we have around the efficacy of Schwartz rounds, because this has been studied, and we view Schwartz rounds as a really important source of social support, and we have studied their impact. We've done an early study. This was a big study, 16 sites pre-post longitudinal follow-up. And what we showed in our study was significant correlations between the frequency of participation in Schwartz rounds and outcomes in 3 key domains: a sense of efficacy and being able to respond to some of these socio-emotional challenges, a greater sense of appreciation and understanding of the roles and contributions of our coworkers and colleagues, improved communication and teamwork, an increased sense of perceived support, less feelings of stress and isolation. I also want to point you to a large government-funded study that took place in the United Kingdom by Jill Mabin and colleagues, and their work was a prospective pre-post 10-site longitudinal study with a comparison group. And I think what was really interesting in this study was that there was a 19% decrease in clinically concerning measures of psychological distress. They used something called the General Health Questionnaire, GHQ-12. 19% decrease in psychological distress in participants versus 3% in non-participants, so that the odds of being identified as an individual that needed a psychological psychiatric intervention was 72% lower for people who attended the rounds fairly regularly. And that was a very low bar. I mean, it was about half of what was offered. In some places, that was just 4 sessions. So we have, some pretty interesting, compelling evidence supporting the impact and efficacy of Schwartz rounds. I do want to also, though, talk about stress first aid. Early in the pandemic, we launched a COVID-19 webinar series on stress first aid and related topics that was very, very widely viewed. And the viewership really supported our belief that we had to launch stress first aid and we had to offer this service to our members, which we did. And so we started out by looking at the literature and the data and the evidence and the research. And we really referred and relied heavily on this paper by Hopfall and colleagues that really access the expertise of this incredible international group of experts in trauma and emergency preparedness. And what they said was that there were 5 essential factors that were evidence informed that promote recovery from adversity of stress. And that includes the ability to promote a sense of safety or feeling safer, calming, connection, self-efficacy, and hope. And it's these 5 factors that are built into the core actions of stress first aid. Our model is a self-care peer support model. It was developed originally for and by the military, and then it's been adapted for other high-risk occupation. And we worked with a consultant from the National Center for PTSD to adapt it for healthcare. The aims of stress first aid are to preserve well-being, to prevent further harm, and to promote recovery. And it includes tools, including 7 core actions that will help you to identify and address early signs of stress in yourself and others in an ongoing way. So this is not like a crisis stress response. This is an ongoing, all the time, really culture changing intervention that provides common language, skills, and tools to help you recognize signs of stress in yourself and in others, and to really promote the sense that it really is okay to ask for help and to reach out, not just for help for yourself, but for others, and to support your coworkers and colleagues. So this is a schematic kind of the core actions of stress first aid. And to the initial 5 elements that I showed you from that Hopfall paper, check and coordinate has been introduced. The ability to really figure out how to respectfully approach and check in with a colleague who might appear to be distressed, to figure out what they're willing to do and not to do, to collaborate in a collegial and respectful way, and when necessary, to help get them referred to higher levels of care. The safety piece of that 5 essential elements is cover, calm is the same, connection and connect is the same. Competence is self-efficacy, and hope was termed in behavioral form as confidence. So these are the 5 core actions, and the stress continuum is part of the stress first aid program. And this has really taken root, and we're seeing people posting this all over the place. And what I think is helpful is that many organizations are using the stress continuum and using each zone to indicate, okay, here in our organization is where you can reach out for help if you find out that you or another colleague is in one of these zones, progressing from the red all the way, back to the green. So you can use this as ways to guide action, and you can embed this into workflow. So our program is a train-the-trainer program. It involves building this common language, training champions, and people have done all kinds of things, ranging from doing sessions across in-service conference sessions, peer supporters being trained, including this in orientation and the like, all kinds of ways that people have used to integrate this into ongoing daily work. People are posting the stress continuum where people gather, either to take a break or to chart or whatever. Often these are being, the stress continuum in particular is being used in huddles and in rounds. Where are we at on the stress continuum? What do we need to do to get people into the green or the yellow zones right now? And at least one organization has actually included this in their app-based daily COVID attestation checks to report to work. So lots of ways this can be built into organizational structure and work. So, right now what I'd like to do is just switch over and share with you just some things that I've learned about resilience in crises. For me, like many of you, I think it's been a period of reflection, a period of study, and I have to say it's been challenging really to sustain my own sense of, social connection and social support. But I'd like to just humbly offer to you some of the things that I've been thinking about and things that I have learned. It has become very clear to me that prioritizing well-being and planning in advance proactive work is just absolutely critical. You can't be trying to jump into action when the crisis hits. Resilience is not about bouncing back to some pre-existing state. Resilience involves ongoing, dynamic, adaptive coping. It is a continuous, ongoing response. It involves continuing reflection and continuous learning, both at the individual level and at all levels, team and organization. We already knew from the burnout epidemic that you can't just target individual with interventions, to support their well-being, and then return to them to contexts that make it impossible in a way that sort of victimizes the victims. We have to have interventions that function at all of these different levels. I also know that time for rest and sleep is essential. It really makes a difference in your mood. Also, that social support is the most common strategy, far and away, the most common strategy healthcare workers use to take care of their mental health. This has also been seen in high-risk occupations like, the military and law enforcement and stuff like that. Because, people will use social support in their social networks outside of work, for sure. But if you really want to talk to somebody who knows what your experience, who has walked your walk, you're going to turn to someone who's been there with you. So we need to acknowledge and just say, yeah, this is true. We all have our own preferred sources of rejuvenation and resilience, whether that be your sense of spirituality, meditation, turning to your social supporters, your connections, whether that be reading or just getting out into the natural world, whatever it is, just knowing what it is that sustains you and building time into your day to try to do some of that. Don't give up on that. That self-care, that self-compassion is absolutely essential. This phrase is something that I've told my own children at many times, facing crises and all kinds of problems. The only way around a challenge is to head directly towards it with curiosity and reflection and an open mind. Compartmentalizing our feelings is necessary. I mean, if you're really in the midst of some really stressful thing and you have to focus. During the code, you're not going to lapse into self-reflection. But, compartmentalizing over the long run really inhibits recovery and growth. We have to have time to process what we're experiencing, or otherwise will just stay with us and we'll never get beyond it. Here's something else that's so interesting, and it's really reflected, in those sort of the duality of themes that we were talking about in virtual Schwartz rounds, that negative emotions are joined. They're not replaced by positive emotions, like gratitude and joy. They coexist. And again, this holding of all this complex and complexity of sort of dueling and seemingly contradictory emotions, they're not at all. They're just part of the complex human experience. Post-traumatic growth really is an entity. I'm just wondering, though, if the post part of it is a little bit of a misnomer. And I'm no researcher, and I can't say this for sure, but we have to be in a place that's safe enough to be able to reflect and to process. Yes, that is definitely true. But as we're going through those places, and those places seem to come and go, ebb and wane, it seems to me that growth can occur even while we're trying to make our way through a crisis. A little bit more of a point about post-traumatic growth. I wanted to just put a little bit of a definition before you. Viktor Frankl was a psychiatrist and a Holocaust survivor. He wrote Man's Search for Meaning, which is a must-read in my recommendation. He said, a significant element in the positive change that individuals experience in the wake of trauma is a transformation of their understanding of themselves, of their understanding of the priorities of life and their place in the universe. These are areas that are viewed by some persons as religious and more generally as existential issues. Dr. Rich Tedeschi and Dr. Larry Calhoun are psychologists who have done a lot of research on the entity of post-traumatic growth and created the Post-Traumatic Growth Inventory, which includes these 5 areas: relating to others, finding new possibilities in life, discovering personal strengths, a sense of spiritual change, and appreciation in life, or appreciation of life. So we're going to launch another poll, and I'd be really interested to see in which of these areas have you experienced the most growth over the past 18 months? And I know that it may be that in more than one, but I'm going to kind of do a forced choice here, and I'm just curious about where we will find ourselves. So jump in and fill in this poll, and let's see what we're seeing. Keep jumping in. I love to see a lot of people responding. A couple of more minutes. Starting to even out. I think the trends actually are pretty clear, so we can end the poll. It's so interesting. Thank you for doing this. It's fascinating. So an appreciation of life seemed to be, the front winner in terms of themes, followed by personal strengths, discovering and accessing them, new possibilities relating to others, spiritual change, and only 4% saying none of the above. So let's stop sharing this poll. We'll close the poll out. And I would just like to end by thanking you all, thanking you for participating, for jumping in, for letting us sort of take the temperature of where you are at right now. I want to leave you with my own profound sense of gratitude for your enduring commitment to compassion. And I hope that the knowledge that resilience and growth is possible if we practice self-compassion, self-care, and those small acts of kindness and support for one another that, in Ken Schwartz's words and experience, made the unbearable bearable. So I am going to end, and we have some time for questions. So let me stop I'll leave up this nice portrait. Steph, do you want to come back on and ask me some of the questions that are posted?
Sure. Well, first of all, there are lots of questions, Beth, about the slides, and whether we'll be. I want to share with everyone we will be posting the recording on the Schwartz Center's website tomorrow in the Compassion and Action webinar archive. And as for the slides, I'm not sure if those will be posted, but I know we do have some related reading and some of the sources from which Beth shared some of the data in the presentation today. So we'll have that up tomorrow. Anything else, Beth, you want to add to that?
No, I mean, you can re-listen to the recording too, once it's up there.
Yeah, and please do share this far and wide. I see a lot of appreciation for the presentation, and we want to obviously get all this information out as far and wide as possible. So I'll just give everyone a second to post any questions you might have. And you're welcome, Megan. Thank you, Beth. The appreciation continues.
I appreciate all of you. Honestly, we draw such inspiration from all of you, and you really power everything that we do. So thank you.
I was about to say that. I know we have some of the team from Montefiore on the line today who did some of the work that you cited, Beth, and We do look to all of you for inspiration. You're the ones who bring this work into the world, and we couldn't do it without you. I will say that if anyone wants further information about our programs, you can feel free to email us at info@theschwartzcenter.org, and we will get right back to you. Thanks, Alina. Here's a good question, actually, Beth. What do you think is coming? What do you think is ahead in the next year in terms of the psychological state of healthcare workers? It's a big question, but I think it speaks to the urgency of some of this work.
You know, I would be loath to predict. I'm worried. I'm very, very worried. I'm worried about the young caregivers. That's really, really that is sticking with me. And you know, it's across the entire U.S. population as well. If you look at all the stats on you know, mental health concerns, the young are just being so profoundly affected. And you can see it in our caregivers as well. I think we really need to put our efforts into supporting, you know, supporting those groups. You know, the other thing, it's very clear to me that everybody has different needs, and different kinds of social support is needed by different sort of subgroups within the caregiver population. We saw that in the burnout literature too. Things that drive burnout, for example, amongst nurses are different from things that drive burnout amongst physicians. So I think it really is important for all of us who are doing this work to try to look at what are the drivers, what are the key concerns, what are the needs, and to try to really adjust what we're doing to what our different populations are within the caregiver workforce. So I'd hate to make a prediction, and I certainly don't want to sound too pessimistic, but I will share that I'm concerned, and hopefully you're concerned enough to just jump into action and get to work. Let's not forget the positive messages and the positive data that we saw in the surveys that I shared. What is driving that? You know, instead of sort of focusing on the negative, what if we use things like appreciative inquiry to find out, you know, when we're at our best in supporting optimism and motivation and hope, what the heck is it that we're doing? And let's try to build out on that.
That's great. Beth, there's actually a question sort of in that vein. Are there strategies that you've seen that have helped to improve receptivity to support?
You know, I think that all of these initiatives that communicate the message that people are having a normal reaction to an abnormal set of circumstances, the overarching communication and messaging has to be developed and implemented immediately. I think when supervisors, managers, and especially when leaders are messaging that it's okay, you know, to give thanks, to let people know that they value what you are doing. Remember, we showed you in the Coping with COVID survey that a sense of being valued by your organization was absolutely critical to mitigating stress. Leaders, managers, supervisors, anyone who works with people who report to them, focus on that. Figure out what people need if you can, if you have the time and the bandwidth, or, you know, make time. Because if we don't have our teams working effectively, you know, we're just not going to be able to sustain the work that we do. So I would say that messaging, trying to understand exactly what the needs are, expressing a sense of gratitude, appreciation, and value, not just in words, but coming down and speaking to people on the front lines, people who are in the high stress locations, offering practical supports. That's what makes people feel valued. So I would just emphasize some of that.
Fantastic, thank you. I want to emphasize again the importance of the role of leaders in that, and I think even in the programs that we run with our member organizations across the country, we've seen consistently before the pandemic, since the pandemic, that when leaders show up not as leaders, but as humans who are also working to provide compassionate care, it makes an enormous difference. There's some fantastic comments as well. Oh, and this comes up a lot in conversations with our member organizations. How do we heal? How do we move forward when we're so fractured by the animosity between the vaccinated and the unvaccinated? And I know that's causing so much moral distress within the workforce and between the workforce and the communities that we care for.
You know, that's really it's bothering me a lot. I will say that coming up in a couple of weeks, actually, we're offering a webinar on how to cope with the anger and the frustration that is out there from sort of the animosity and hostility in uncivil discourse right now. So we will be offering that. It's Christina Runyon who will be offering that next webinar, which is in 2 weeks. So tune in for that. Also, I can't help it, but I read a wonderful piece by Dr. Rena Oddish, who is one of our National Compassionate Caregiver of the Year awardees and was our keynote opening speaker for our conference this year. She wrote and published just a wonderful piece in the Annals of Internal Medicine. I actually put it on my LinkedIn page. So if you want to take a look at that, and maybe we can just offer that up, Steph. I don't know if you have that link, but we can post it. And it was just about that. It was about somebody who was sort of a denier and how she found her way to just sitting down and listening and sort of connecting on a deeper level and finding ways to connect that didn't involve hostile conversation, but just connecting as a human being from one person to another and finding a place where, yeah, we all have the same concerns. We all have very similar values. What we have to get to is in what ways do our value, our appreciation of life, our love for our families and our loved ones, in what ways can we find common ground in that place of compassion and of connection? So, this is not like there's a simple algorithm about how to manage it, just as some suggestions about how maybe us as individuals can navigate that really difficult and challenging terrain.
Yeah, thanks, Beth. And I don't have Rena's article on hand, but we will post it alongside the recording on the website. I am going to pop into the chat the registration link for Dr. Runyon's webinar in 2 weeks' time, which should be absolutely fantastic. So just scroll down on the page that I linked to, and hopefully you'll register to join us in 2 weeks for another session. Any final words, Beth, as we bring things to a close today?
I just would say thanks to everybody. It actually is very sustaining to know that you are listening and that you care and that you're showing up and that a majority of us still somehow manage to find it in our hearts to offer compassion and to hope and to be optimistic. So please, not to deny all the negativity that we're feeling as well, but if you can find ways to hold these conflicting feelings and work your way through them, I think we will be able to find a place of resilience. So I just do want to thank you all. Thank you for being here today as well.
Well, and thank you, Beth. What a fantastic session. I know I'm speaking on behalf of all of the folks typing into the chat. This was really an incredibly inspiring and important conversation. Thank you, everyone, for joining us. Please come back. If we didn't get to your questions or comments, I apologize. We did our absolute best, and we're always excited to see on our end the discourse that's sort of happening and taking place. We do hope you'll join us in 2 weeks' time, and we hope you'll come back for more conversation with the Schwartz Center. In the meantime, we really do love your feedback. We'll be sending you a very brief survey about today's webinar in your inbox, so keep an eye out, and we read every comment, so please take a moment to fill that out. In the meantime, I join Beth in just thanking you for all of the work that you're doing and for showing up today. We appreciate your commitment to compassionate healthcare, to doing all of this work. We hope you'll take care, and we hope to see you again soon.